Tumors of the iris, from the Department of Pathology at the Wills Eye Hospital. I have no financial disclosures relevant to this presentation. Most iris tumors are melanocytic. They include freckles, melanocytomas and spindle cell nevi, and malignant melanomas. Several iris freckles and an iris nevus are seen in this photo. Iris freckles are quite common. They are slightly elevated and have irregular borders. Iris freckles are found in more than 50% of adults, but are not present before age 6 and are rare before age 12, according to Algernon Rees. This scanning electron micrograph shows a large iris freckle. The surface of the freckle is elevated from the surrounding normal stroma and is covered with round cellular processes. Under higher magnification, the cellular processes are filled with melanin granules, and they have a raspberry-like or framboisiform appearance. The round cellular processes are also seen on the surface of this freckle in a routine micrograph. Although some suggest that nevi are an area of increased pigmentation of the anterior border layer, there is evidence that suggests that they are a type of nevus. They are not present in infants and appear and darken with aging. They do not resemble normal dark iris stroma morphologically, and they have larger melanosomes than normal dark stroma. Unlike normal stroma, they do not fade with denervation, and many are fairly discrete and focally elevated. In addition, they resemble the iris stroma in the nevus of Oda. This scanning micrograph shows the anterior surface of the affected dark iris of a patient with nevus of Oda. In contrast, the patient's normal medium brown iris looks totally different. Iris nevi include rare melanocytomas or magnocellular nevi. Although melanocytomas are classically associated with the optic nerve, they can occur in any part of the uveal tract, including the iris. Melanocytomas are intensely pigmented, and bleached sections are generally required to assess them histopathologically. This photo shows an intensely pigmented melanocytoma of the peripheral iris. Histopathology shows the intense pigmentation that obscures the nuclei. Nuclear details and the tumor's bland nuclear cytoplasmic ratio are evident in the bleached section. Most pigmented tumors of the iris are benign nevi. Spindle cell nevi comprise the benign end of the spectrum of melanocytic spindle cell tumors. They may progressively enlarge and occasionally can undergo malignant transformation. This scanning micrograph of a spindle cell melanoma shows the spindle cells arranged in a parallel fashion with long tapering apical processes. Here's histopathology of another spindle cell lesion. Many of the nuclei in this case are quite bland. Iris melanomas. There are certain features that suggest that a pigmented tumor is a melanoma. I think one of the most important of these is documented tumor growth. Other factors include elevation of intraocular pressure, hyphema, large tumor size, and tumor vascularity. Most pigmented tumors of the iris do not enlarge when they are observed. A study from the Wills Ocular Oncology Service showed that the risk of enlargement was only about 6.5% in 5 years. Iris melanomas typically occur in the inferior sun-exposed part of the iris. The mean age of affected patients is about 10 years younger than patients with posterior segment melanomas. They tend to have a relatively favorable prognosis of 4 to 10% mortality in some series. In the past, the mortality of bona fide iris melanomas probably was underestimated due to the inclusion of nevi in the series. The prognosis of iris melanomas actually may be similar to posterior segment tumors of similar size and cell type. Most iris melanomas are small, and many are low-grade spindle cell tumors. Types of iris melanomas include low-grade spindle cell melanomas, spindle B melanomas, mixed cell melanomas that contain spindle and epithelioid cells, rare epithelioid melanomas, diffuse iris melanomas, and 2 types of tapioca melanoma. A plaque of spindle cells is often present on the anterior surface of low-grade spindle cell tumors. The spindle cells typically have bland oval or cigar-shaped nuclei that have finely dispersed chromatin and lack nucleoli. The pathologic assessment of iris spindle cell tumors can be challenging. It's often difficult to determine whether one is dealing with a low-grade spindle cell melanoma or a spindle cell nevus. Mitotic activity usually doesn't help because there's generally very few mitoses in iris melanomas. Here's an interesting case that we examined a few years ago. This was a patient followed by the oncology service for a flat iris nevus that suddenly developed this pedunculated nodule. The initial basal part of the tumor is composed of cells with very bland nuclei consistent with nevus cells. In contrast, the nodule contains cells with prominent nucleoli consistent with small epithelioid melanoma cells. Here's another interesting case. This was a fairly young man that was followed for this lesion that was initially thought to be a nevus. He was followed for, I think, 11 years. He may have been lost to follow-up, and when he returned, the lesion had definitely grown and produced ectropion of the iris pigment epithelium. He also had this area of presumed extraocular extension. His eye was enucleated. We see a plaque of lightly colored cells on the anterior surface of the iris in the enucleated specimen. Histopathologically, the plaque was composed of bland amelanotic spindle cells. However, tumor was noted in the emissarial canals within the sclera overlying the trabecular meshwork, and extraocular extension was present. Although most iris melanomas are low-grade spindle cell tumors, higher-grade lesions do occur. The large, round, bizarre cells seen in this scanning micrograph are presumed to be epithelioid melanoma cells. Again, not all iris melanomas are low-grade. This tumor contained epithelioid cells and was classified as a mixed-cell melanoma. This iris tumor was the most anaplastic melanoma I have ever seen. The tumor developed rapidly in the eye of a physician while he was on vacation. The tumor was locally resected. It was composed of numerous, wildly anaplastic epithelioid giant cells and had severely atypical mitotic figures. The tumor recurred and involved the posterior segment requiring enucleation. An important type of high-grade iris melanoma is found in patients who develop hyperchromic heterochromia iridum and secondary unilateral glaucoma. These patients typically have diffuse iris melanomas. This photo shows tumor cells blanketing the anterior surface of the patient's iris. The eye was enucleated. The angle is closed. Pigmented tumor infiltrates the iris stroma, and a plaque of amelanotic cells is present on the anterior surface of the iris. The plaque is composed of small, non-pigmented epithelioid cells, shown here in this scanning electron micrograph. Beware of iris tumors that cause hyperchromic heterochromia iridis and secondary glaucoma. Most diffuse iris melanomas are higher-grade lesions that contain epithelioid cells which are poorly cohesive and subject to aqueous dispersal. This paper from the Wills Oncology Service reviewed 25 cases of diffuse iris melanoma. In half of these cases, the patients complained that their eye had become darker. 80% of the tumors contained epithelioid cells. Misdiagnosis was common. More than half were initially diagnosed elsewhere as having glaucoma, and almost a third had prior laser or surgical treatment. 4 of 7 cases that had extraocular extension had prior filtering surgery. Liver metastases developed in 13% of the patients, a high incidence for iris melanoma. Here's another interesting case, a young man who presented with pupillary distortion and a small pigmented iris lesion. He was followed and returned 18 months later with diffuse pigmentation of the iris and lens. He had also developed secondary glaucoma. A gonio photo shows tumor obstructing the angle. His eye was enucleated. We see multiple seeds of pigmented tumor on the surface of the iris. These scanning micrographs show the seeds of tumor on the anterior surface of the iris. Here's another example of diffuse iris melanoma. The patient developed multiple foci of pigment on the iris and secondary glaucoma. The gonio photo shows tumor cells extending circumferentially around the angle as a ring melanoma. The patient's normal angle is seen below. Here's a photomicrograph of an epithelioid cell-rich diffuse iris melanoma that is infiltrating the trabecular meshwork. The scanning electron micrograph shows tumor cells blocking the trabecular meshwork. Here's another man who developed acquired hyperchromic heterochromia iridis and unilateral glaucoma. He has a variant of diffuse iris melanoma called multicentric tapioca melanoma. He had multiple nodules of tumor on his iris and in his angle. This macro photo shows multiple tumor nodules on the surface of the iris in the enucleated eye. Scanning electron microscopy of the same area is shown here. False colorization highlights the tumor nodules and individual melanoma cells dispersed on the anterior surface of the iris. This photomicrograph shows several tumor nodules resting on the anterior surface of the iris near the pupillary margin. There are actually two types of tapioca melanoma. Solitary nodular tapioca melanoma is most common. These patients have a discrete, lightly pigmented spindle cell melanoma with a pebbly surface and don't have glaucoma. Our patient had the rarer type of multicentric tapioca melanoma, which is a variant of diffuse iris melanoma. These patients have scattered tapioca-like nodules, severe glaucoma, heterochromia, and epithelioid cells. High-grade melanomas can also masquerade as uveitic glaucoma. We've recently examined the eye of a 27-year-old woman who was thought to have unilateral granulomatous uveitis. This did not respond to therapy and the pressure was highly elevated. The unilateral uveitic glaucoma was treated with a tube shunt. Here's a clinical photo of the patient. A pseudohypopion composed of focally pigmented cells is seen under higher magnification. Clumps of tumor cells appear to be present in the lumen of the tube shunt. A gonio photo shows focal synechii and deposits of non-pigmented tumor blanketing the iris and angle. A fine needle aspiration biopsy was done, and this disclosed highly malignant tumor cells. The eye was enucleated. Histopathology discloses a clone of discohesive amelanotic epithelioid cells on the anterior surface of the iris, shown here under higher magnification. Cytology of fluid aspirated from the capsule of the tube shunt disclosed multiple tumor cells that had extended extraocularly through the tube. It is important to exclude the possibility of an unsuspected tumor in patients with unilateral glaucoma prior to tube shunt implantation. I have seen other cases where unsuspected intraocular tumors have invaded the orbit through tube shunts. There is an exception to the general rule that acquired hyperchromic heterochromia iridum and glaucoma equal diffuse iris melanoma. That exception is melanocytomalytic glaucoma. The eye on the right had an extensively necrotic melanocytoma. The partially necrotic tumor is seen in this gonio photo. Extensive areas of necrosis are found in many melanocytomas. The necrotic tumor is phagocytized by macrophages, and the melanophages block and infiltrate the trabecular meshwork, causing secondary open-angle glaucoma. This scanning electron micrograph shows melanophages blocking the trabecular meshwork. It is important to remember that an iris tumor actually may represent anterior chamber invasion by a ciliary body melanoma. Clinically, the ciliary body component can be disclosed by transillumination. Not all pigmented iris lesions are melanocytic. This photo shows a rare adenoma of the iris pigment epithelium that is invading the anterior chamber. The photomicrograph shows the bands of pigmented neuroepithelial cells that are eroding through the iris stroma at left. Iris metastases comprise about 8% of metastases to the uveal tract. This is an example of metastatic lung carcinoma to the iris. Multiple foci of metastatic breast carcinoma are seen in this photo. Breast and lung carcinoma are the most common primary tumors that metastasize to the uveal tract, including the iris. In this series reported by the Wills Oncology Service, almost one-third of the patients had no prior history of cancer. This photomicrograph shows a rare case of metastatic mucin-secreting adenocarcinoma of the esophagus to the iris. Secondary involvement of the iris by systemic non-Hodgkin's lymphoma has caused heterochromia in this patient. A pseudohypopion of lymphoma cells is present in the anterior chamber. These photos show massive infiltration of the uveal tract by systemic large cell lymphoma. The lymphoma cells infiltrate the iris and block the angle. This photo shows iris involvement by recurrent leukemia. This photo shows an exceedingly rare case of primary rhabdomyosarcoma that arose from the muscles of the iris. Cysts of the iris pigment epithelium can masquerade as uveal melanomas. This is an example of a mid-zonal iris pigment epithelial cyst. Iris involvement occurs in juvenile xanthogranuloma. It is a common cause of spontaneous hyphema and secondary glaucoma. Teuton giant cells are found in the xanthogranulomatous infiltrate. Chorostomas composed of intraocular lacrimal gland tissue are other rare lesions that occur in infants. I've seen several cases of this rare tumor. Thank you for your attention.